Okay. Anyway, okay, I will move on. So before we get to the introduction of our speaker, I just wanted to go over a few topics. So if you're on the Zoom call with us, please leave yourself muted for the duration of the program to minimize background noise. And you can post your questions either in the chat or in the YouTube live stream comments if you're watching on YouTube. You can also email them to lwvpiedmont@gmail.com. And I will moderate the questions and we'll get through as many as we can in the last half of the program. If you are joining us on YouTube, please subscribe to the League of Women Voters YouTube channel. And if you click the bell, you'll get notifications of future events that we stream on the channel. To get advance notice of events, please join our mailing list, which you can do at www.lwvpiedmont.org. And you can also join the League there. Your membership in the League, if you do choose to join, helps support the grassroots efforts of the League, both locally and at the state and national levels. And our efforts in voter education and advocacy to influence public policy is extremely important work right now and for the foreseeable future. So without further ado, I'm going to turn things over to Julie Chang, who will, she's one of our program committee chairs, and she will introduce the program today.
Hi, everybody. I'm Julie Chang, and I'm very pleased to introduce Margot Kuchel, medical doctor who's the director of the University of California, San Francisco Center of Vulnerable Populations. Now, our committee had taken votes on what topics we wanted to cover, and one of them that came at the top of the list was homelessness. So Dr. Kuchel is the primary investigator of several multi-year studies on the homeless populations in the Bay Area since 2012. So I watched some of her presentations on YouTube, and I found her very easy to understand, and I wanted to learn more about homelessness and what to do. So she emphasizes the effects of housing instability on healthcare outcomes and has some solutions to share for us. I'm sure that's all what we're looking for. So without further ado, go ahead, Dr. Kuchel.
Thank you so much for inviting me and for that introduction. And thank you for joining today in this time of COVID. What I wanted to do actually is hope that at the end of the talk, I'm going to leave everyone with both a bigger understanding of why we're in this mess and a sense of hope that we can get out of this mess, but maybe make the mess even explain why in some ways it's more problematic than it seems or harder to solve than it seems. But then my hope is to leave everyone with a sense of optimism about what the next steps would be. I want to talk about, I'm going to first start and talk about, like, the truth of it is we know exactly what causes homelessness, but it might not be what you think it is. And, most people, when I ask this question of what causes homelessness, mostly what people say is mental health and substance use. And that really isn't the cause of homelessness. And I will later in the talk explain why I know that. But really the cause of homelessness is through three root causes as I see it. One is the lack of what we call extremely low income housing, or that's housing that is affordable and accessible, affordable and available to households that make less than 30% of the area median income. The second is income inequality. So we see a lot more homelessness in areas with more income inequality. And then the third, which really undergirds those other problems, is the ongoing insidious impact of structural racism in our country and all of the ways that it plays out. What doesn't cause homelessness is mental health and substance use. There's no question that people with mental health and substance use disabilities are more at risk for homelessness. But the truth is, I'm a physician. Those illnesses or those problems don't scare me. We actually can house people very easily who have those problems. And it isn't really, we could perfect our mental health system, which is far from perfect. and, come up with great treatments for substance use, and we would still have the problem we have if we don't get at the real problems. I also want to talk about the fact that we actually know what solves homelessness, and that part is easier than it seems. Basically, almost everybody who's homeless, and I will give some evidence for that, can be housed if we get people housing that they can afford. Some people need a fair amount of support services wrapped around that housing. Some people don't. But at the end of the day, housing that people can afford is the answer, which seems so obvious, but it's amazing how far we often are in our policies from that. The third thing I'd like to talk about is what happens when we don't solve it. What is the price of homelessness? I think you are all likely aware of the many moral and sort of economic costs to having our neighbors and other people sleeping on our streets and in our shelters. But there are just absolutely enormous health consequences of homelessness. And I think that really played out during the pandemic. And the last, I just want to just talk about some solutions at scale and some things that are happening right now in our region and our state that would be good things to pay attention to or to get involved with if you are interested in it. So let me back up and start talking about some of those terms and things that I just brought up. So the first is ELI housing. So extremely low income housing really just means what it says, which is housing that's available and affordable to people who make less than 30% of the area median income. The median income in the Bay Area is really high, so that actually number is quite a bit higher than it is in other places. But that figure is adjusted, meaning that what counts as an ELI household in the Bay Area is very different than what counts as an ELI household in a small town in Mississippi. But California has the second worst problem in the country with lack of ELI housing. And just to give you a sense of scale, in the nation right now, there are only 36 units of housing that are affordable and available for every 100 ELI household. In California, we only have 23 units affordable and available. The only state in the nation that's actually worse than California is Nevada, who has 19 units. But what that means is for every 100 household in our state that makes less than 30% of the median income in their region, again, that's different in Fresno than it is in the Bay Area, there are actually only 23 units that they could possibly afford at a level that's considered affordable. And affordable means that they only spend 30% of their income on housing. Now, for higher income families, like we see young doctors and things in the Bay Area spending 40 or 50% of your income on housing. That's actually much harder to do if you're poor, because a lot of the other expenses are relatively fixed. Like there's only so much food, people can eat, but there's also, they need to eat food. And so if you're poor, spending more than 30% of your household income on rent actually causes all sorts of other problems. People don't get enough to eat. They don't, invest money in their kids' education. They don't have money for healthcare, and they're at very high risk of losing that housing. Because if you're spending more than 30%, it means that you're like living on the edge every month, and you're one small disaster away from losing that housing. We are not going to get to the bottom of this problem until we fix that shortage. We don't have to get it to 100, but we have to get it a lot better than it is now. The second thing is income inequality. People often say poverty causes homelessness, but if you actually look across the country and you chart out like where are the poorest areas and where are the areas with highest homelessness, they don't match. What actually matches is we see the highest level of homelessness in the sort of blue states, which are often areas that are marked by high income inequality. So if you look at a place like East St. Louis, Missouri, Illinois, or Detroit, much poorer cities in the Bay Area, they actually have much lower rates of homelessness than we do. And so this is related in part to housing costs. In high income inequality areas, there tends to be less housing available for low income people. What we've seen since 1980 is a relative flattening of incomes for people at the low end of the workforce, right? So the low wage workers, we know the minimum wage hasn't increased, their buying power hasn't increased, but housing costs, particularly in areas with high income inequality, have gone way up. It's estimated that in the Bay Area, the housing wage is $60 an hour, meaning if you had one adult in the household working 40 hours a week, that adult would have to earn $60 an hour to be able to afford to live in the Bay Area. That's obviously unsustainable and obviously, is not what's happening. So what you see is many households crowding together. At the beginning of the pandemic, part of my job was to call every person in our clinic who was diagnosed with COVID. So every night for the first 3 or 4 months of the pandemic, I spent 3 or 4 hours on the phone calling one after another, anyone who got a positive COVID test from my clinic. And what was really interesting to me is that, first of all, I went through about 3 or 4 weeks without one speaking English. It was almost all Spanish speaking households. And the other thing is when I called them, because I was worried about infection control, I was asking who else was in the household because I needed to know like who else we needed to worry about, putting in quarantine. And what was sort of shocking even to me, and this is what I spend my life doing, is that these households were not homeless. They were housed, but it was not at all unusual for me to take a list of the people in the house and there would be 14 or 15 people in a 1-bedroom or 2-bedroom apartment with 1 bathroom. And that is actually why you see all of this about like the pandemic raging in certain areas. It's not housing density like big apartment buildings in New York did not, that wasn't the problem. It's actually housing crowding. That what happened is if you have 15 people living in a 1-bedroom apartment, one person in that household gets COVID, very quickly everyone else does as well. My son a few weeks ago got COVID, but like, thank goodness, knock on wood, none of the rest of us got COVID because I live in a nice big house and we put him up in a room. We didn't let anyone else use the bathroom. And actually none of us got sick. But that isn't true for people who are crowded. What also happens for people who are crowded like that is eventually it sort of works until it doesn't work, right? You've got 14 people crowded into a 1-bedroom apartment. You're sort of one fight away from being kicked out. And a lot of our programs that are sort of eviction prevention don't actually work very well because it's like these folks might not actually be on the lease. They might just be like contributing some rent to their brother so they can stay there. So there's actually no protections for them when things fall apart. And that is in some ways, homelessness is the tip of the iceberg for this much larger problem having to do with housing affordability. So let me talk about structural racism. And the reason why I have made a commitment a number of years ago to not have any talk about homelessness without naming racism is I actually think it's really important, particularly, I'm a white woman, for like white folks to understand why and how this plays out. Nationally, if you are Black, you're 3 or 4 times more likely to be homeless than if you're white. In the Bay Area, that's actually even worse. San Francisco right now, about 5% of San Franciscans identify as Black, and 37% of those who are homeless do. In Oakland, they're about 25% are Black, and about 80 to 85% of people who are homeless are Black. The reason for this has a lot to do with all the ways that sort of racism has sort of affected people throughout their lives. But one that I really want to point to is that housing has been in this country really the primary means of wealth building. I know, my family, my mom was an immigrant. My dad was very working class household, but they got some money together, put down a down payment, moved to the suburbs, and that house gained an incredible amount of value. And frankly, it was like that house that allowed my brothers and I to go to college and, and sort of propelled everything. After World War II, there was this big explosion of home ownerships and a big explosion of the suburbs and all of that. And basically, Black folks were really excluded from that. So, early on in the century, until the 1950s, it was perfectly legal. And it was, in fact, sort of written into the laws that you could have things like racial covenants. Like you could have neighborhoods that could agree to not sell a house to anyone who is Black. And in fact, if you were a homeowner and wanted to sell your house to someone who was Black, you could you were not allowed to do that. Then what happened is it was perfectly legal for banks to say that they would only give mortgages to people who lived in certain areas. And this is a term you've probably heard, redlining. So basically they were maps drawn. And if you lived in a neighborhood that Black people were allowed to live in, you actually couldn't get access to mortgage insurance. or if you got a mortgage, it was at really usurious rates. And so this actually had the impact. And then like, the GI Bill and people using mortgage, that was not offered to Black folks. So basically Black folks lost the ability to buy into housing. And that, there are lots of reasons why Black and white wealth is so different, but housing is one of the most direct and specific reasons. And we see those old red line patterns still exist to this day. Like you can see where they are, even though we've had fair housing laws now since the 60s. Fair housing laws, we know, it's great that we have them, but they're not terribly well enforced. And that means like people have done sort of secret shopper studies where they've pretended to rent an apartment, and they'll have a household where they'll have like a white person show up and they'll have the same resume as a Black person. And what makes it easy to rent a house, if you're on the edge of being able to rent a house, it's actually children count against you, prior evictions count against you, like more income counts for you. So they basically construct these resumes that look exactly the same. And they've shown that even today, if you're a Black person and you show up with the same resume, but they change the name to one that maybe sounds more culturally Black, and you're a Black person and you show up to rent it, you're much less likely to be offered that house. And so the impact is that Black folks have to spend more money to rent the same house as white folks are, because they kind of get turned down and have to keep going and finding different places. You add to that all of the discrimination that I'm sure know about in the criminal justice system and disproportionate policing and all of those things. You add that to the fact that our educational system is completely linked to housing. Like we send our kids to public schools where we live. And so if you're in a primarily Black district, that's going to have a lower tax base as, school isn't good. You add that all up together, and perhaps it's not surprising that Black folks are at about 4-fold increased risk of homelessness. These are uncomfortable conversations to have, but we actually have to get them because therein sort of lies some of the answers. So let me talk to you about why, despite everything I've said, I'm optimistic that we can end this. In medicine, we deal with a lot of problems that are really vexing and like we have no idea how to solve them. This is not one of those. We actually have a really good evidence base. We know what works. So you might say to me, well, it's great that you're talking about housing, but what about those people that I see on the street and they're, running around and they clearly have mental illness and they're using drugs and you can't just plop them in a house. And the answer is yes and no. You can't just plop them in a house. That won't work. But the answer is we actually know what works. And it's a relatively recent sort of thing, which was even when I started my work with homeless populations, we had this idea that there was this continuum of care. You would sort of get into the homeless system, you'd go to a shelter. If you did well in the shelter, you might be offered a long-term shelter. If you did well there, you might be offered a 2-year housing placement. And if you did well there, you could get your way to housing. The problem is that for the people it worked really well, but lots of people fell out at every step. They got kicked out of the shelter because they drank or all these things happen. And so in the early 90s, this man who's still alive and he's incredible, named Samson Zaris, who's a psychologist, came up with this idea that he based on what was supposed to happen when people left psychiatric hospitals, which was sort of like flipping the model. And it basically said, instead of having this continuum, like this ladder that you have to step through, let's flip it. And let's start with the housing and say to people, even if they're kind of a hot mess, here's housing and we're going to pay for it. So you don't, you only have to pay, if you have a disability check, you pay 30% of your check and we'll take that off the top, but you just pay 30% and that's it. But let's offer you services, but we're not going to require them, which I know sounds really weird because you're like, well, why wouldn't you require someone who's got bad mental illness to take services? But the reason was, as soon as you require it, then what are you going to do if they don't adhere to it? You have to kick them out of the housing and then they're back where they started. So he said, instead, let's offer people the housing. Let's have lots of services available, mental health services, drug treatment, case management, vocational training, but it's completely optional. What isn't optional is that this is your house, you have a lease, and we're here for you. And what they have found is it is remarkably successful. And it's called, you might have heard the words permanent supportive housing, or you might have heard the words housing first. Housing first means you start with the housing with no preconditions. And permanent supportive housing means it's supported, like there are all these services there, but it's permanent. It's not like a 3-month lease that's conditional. This is your home. You've got tenancy rights to it, just like, I would have if I rented a place. just to give you a sense of how successful this is, very recently in Santa Clara County, they were thinking of turning to this model, but the government was a little nervous about doing it because it's a little nerve-wracking, right? You take people who are like, using meth and you're like, here, come on in, here's your house, right? So they were nervous about funding it. So they brought in outside funders through a model called Pay for Success. And what that model is they had foundations and banks actually invest in the program and say, we're going to put up money to start this program. And if the program works, the county of Santa Clara has to pay for it and we'll get our money back with interest. And if the program doesn't work, we lose our money. And that was the deal. And then they needed someone to tell them if it worked or not. So they asked me and my colleague Maria Raven to come in and judge if it worked, because they sort of needed a neutral body because there was a lot of money at stake. And so we did this. And what we did is we only had about 126 units of housing. We went through all of Santa Clara's data and we basically found for them in their system, their ambulance system, their emergency departments, their hospitals, their jails, we actually identified the 400 homeless people who are causing them the most problems. And, and these were people who had been in jail 15 times and in the psychiatric emergency room 16 times, in the hospital 3 times over the course of the last year. These were the people that gave everyone a headache. And we sort of had this theory that if they were always showing up at places, they would show up again. So we didn't need to go out and look for them. All we had to do was wait for them to come in. So we put a flag into all of their, charts in the emergency department and jail, et cetera. And we basically put a flag so that if they showed up in the emergency department, something popped up to the doctors and the nurses and said, hey, this person is eligible, call us. And, but we only had enough housing for a small proportion of them. And so we decided, instead of just giving it to the first 125 people, we would actually choose by lottery who got it and who didn't, and we would compare what happened. And so a few things happened. First of all, literally how this worked is someone would show up at 3 a.m. and they would call us, and someone from the team would show up in the ER and say to the person before they left the ER, hi, Mr. Smith, really nice to meet you. Turns out you qualify for this program that comes with housing. Are you interested? If you sign up, you have about a 50-50 chance of getting it. And the first thing that we noticed is no matter how disastrous these folks were, pretty much all 2 people, 1 person turned us down. Basically, everyone was like, yeah, I'm in, which sort of goes against people's idea of oh, people don't want housing. It was actually, I didn't actually think everyone would agree, but basically everybody agreed. Then as soon as they agreed, they had a team, and the team was a social worker or someone like a master's of family therapy, a master's trained, person with sort of psychology training, with someone who had a bachelor's degree in psychology, and a peer. So someone who had been homeless before. And that team of 3 people had a caseload of 45. So there was basically a 1-to-15 ratio. And they did whatever they needed to get these folks to move into the housing units that we had. And what we found was that 86% of these folks moved into housing. On average, it took 70 days to move them in, because it wasn't like they picked them up at the ER and people just packed their bags and moved in. They had to go out to the encampment and talk to them and get their paperwork done and, get a new, ID and blah, blah. But it took about 2 months to bring them in. And once they came in, they spent 93% of nights for the next 7 years housed. And so, yeah, it wasn't 100%. There were 14% of people who didn't work for it, but it worked for almost everyone else. What this tells me is that if we, and these were we intentionally chose these people because we chose the hardest people to possibly find, and it worked. So what this tells me, if we had these programs to scale in a city like San Francisco, if this is the hardest 5% and we housed, 86% of them, maybe we would have 50 people on the streets in San Francisco. And frankly, if we had 50 people on the streets in San Francisco who needed more different services, more intensive services, we could probably figure out what to do. The other point is that not everybody needs that. About half of people who are homeless at any one time probably need some form of permanent supportive housing. Most people just need a house that they can afford. And this has also been shown in studies. There was this incredible study called the Family Option Study, which was in 7 or 9 counties across the country, where they took homeless families and they randomly assigned them either usual care, you got what we always do, which is shelter and help or whatever you can get, transitional housing, which is that you got 2 years of housing and a bunch of services wrapped around. Something called rapid rehousing, where you get about 18 months of subsidies and a lot of help with the idea that like in those 18 months, you'll get another job or you'll bring up your income, or just handed a Section 8 voucher. And Section 8 vouchers are vouchers from the federal government that allow you to go out into the free market and try to find a house that will accept it. And if they accept it, you pay 30% of your income and the federal government pays the rest of the rent. It turned out that what performed far and away best was just handing people the Section 8 voucher. No social workers, no assistants, like here's your voucher and go. Alameda County was actually one of the counties that this worked in. And they basically showed that the families that got the vouchers remained housed, their kids did better in school. There were like better health outcomes, like everything, better marital outcomes, marriages stayed together, like pretty much everything got better. And it performed actually significantly better than anything else. So why aren't we doing more of it? Well, you've probably heard there's a lot of problems with Section 8 vouchers, like it can be really hard to use them in the Bay Area because landlords don't usually want to accept them. But like the bigger problem is that right now in the United States, of the families that meet the very strict criteria for it, and lots of people have trouble paying for housing and don't meet the criteria for it, but of those who meet their criteria for it, only 1 in 4 get it. It is unlike something like Medicaid, where if you qualify, you get it. Qualifying for a housing choice voucher means that you basically earn the right to get in line and wait for it. And there's just a certain number of vouchers. The Biden administration has talked about fully funding that program. To fully fund that program would be about $37 billion a year, which sounds like a lot, except that we spend about $30 billion a year on homeless shelters. And across the country, and like in California, 2 out of 3 people who are homeless don't even have a shelter. It is a really simple solution. Now, would it solve all the problems? No, we need the housing stock, right? If we suddenly had all these vouchers, there's probably not enough apartment units available. But it is, to me, it is absolutely just crazy that we don't have it. And by the way, in permanent supportive housing, what often happens is you put people in their train wrecks. What we found is their mental health gets better, their use of the emergency department goes down, like all good things happen. They wind up eventually usually using less substances. In San Francisco, we found that people then get stuck in permanent supportive housing because it is the only permanent option, even though they don't need to be there anymore. If we actually could give them a voucher and move them to the regular community after a few years, we would then have another unit of this very specialized housing available. So some folks invested a bunch of money in San Francisco, and we've started to do that. We've started to move people out. And we did this great study of the people who moved out. Many of them had been, on the streets for 15 years and just in terrible shape. And now they're doing great. And they're living like in Park Merced. I don't know if you know it, in like the western side of San Francisco, and they like are watching their grandkid. It was actually really, really moving. But we haven't really been able to do that in San Francisco because there's no voucher for people to go. And what they can't do is afford the market. So what happens when we don't solve this? My friend and colleague, Matt Desmond, who wrote the book Evicted, and if you haven't read it, I strongly recommend it. He had this great line in there and says, like, without stable housing, everything else falls apart. And as a physician, I can tell you, everything else falls apart. Like I got into this business, I spent a lot of years like memorizing the Krebs cycle and learning like the differential diagnosis of vasculitis, but I spend most of my day working on housing. And the reason I do is that I realized pretty quickly that if people didn't have housing, doctors were pretty useless. We can't do that much for people. And so I think it's just so important, because what happens when people don't have housing is they use more substances, their health needs get completely neglected. They show up in the ED, they can't show up at the doc, they can't get a job because try to show up for a job interview when you haven't showered, in 3 weeks, people get really disoriented, they don't sleep. We did a study that showed among seniors, people 50 and older in Oakland who are homeless, about, what was it? It was like 11% were, or 12% were physically or sexually assaulted in each 6-month period that we followed them. Like people get beat up, like it's just a disaster. And I think what we've seen with COVID is what we've seen in things like San Francisco, where early in the pandemic, there was an outbreak in a shelter and 80% of people in the shelter were infected. And so we spend a lot of time managing it, right? We built Project Roomkey. where we have hotel rooms for older people or people with illnesses to leave the shelters. I'm doing rapid COVID testing in the shelters where I have a whole team. We test everyone for COVID in the shelters twice a week right now. And then we pull them out of the shelter into a hotel room if they're infected. It's all good harm reduction, but like there's a big part of me that's like, this is nuts. Like we spend so much time and money trying to solve for a problem, which we really, really don't need to have. So how do we get to solutions at scale? I am a little more optimistic than I've been, but I am sort of an optimistic person. I think the federal government, at least for the next 2 years, is interested in doing something about this. They have some really wonderful people at HUD, Housing and Urban Development. So I feel optimistic about that. And there's a lot of activity both in the state and regionally to solve California's problems. So I want to just tell you about like a few things maybe to keep your eyes out for. There is a movement called Bring California Home, and you can find it online at like bringcalhome.org. It is a movement to put a bond measure. Actually, they're doing two things at once, which is sort of interesting, but they're trying to push the legislature to pass new funding for vouchers, for housing creation, for things to solve homelessness at the same time as they're also going to put a bond measure on the ballot in 2022 if things in the legislature don't go well. That is a movement that's supported by Mayor Libby Schaaf, by many of the local Bay Area mayors, by a lot of the big organizations are on board with this, and they're trying to build momentum to try to move the state legislature and or to get a bond measure passed to try to have a permanent set of funds to create and sustain housing. There's a wonderful organization in the Bay Area called All Home, which is run by Tamika Moss, who's this fabulous inspirational leader that is pulling together the 9-county Bay Area region and sort of saying it doesn't make sense for Alameda to try to solve the problem on its own in San Francisco, because it turns out people move across borders, and actually trying to come up with a 9-county solution and to get all of the counties talking to one another, all sort of doing their fair share and all planning together. So that's another really wonderful organization. There's some incredible nonprofits in the area doing really exciting work. One of my favorites is Bay Area Community Services. It's run by this really incredible woman, Jamie Almanza. And BAX is doing some really cool things, including, you've probably heard people say, oh, it's like $650,000 to build 1 unit of housing for 1 person in the Bay Area. And she basically said, I just don't buy it. And she has gotten philanthropic money and has stood on the courthouse steps when houses are coming up for auction and is buying, like, I know last year at one point, she bought a house a month for 7 months. She bought houses in like Deep East Oakland, in Richmond, in San Leandro. She was finding houses for $500,000 a year. These are often houses like going into foreclosure and things. She put $50,000 in to catch them up. And she basically had like a prototype for what kind of houses she was looking for. And then she would move 5 people off the streets into the housing, 5 or 6, each give them their own bedroom, each put a lock on their bedroom door, and then provide services. And actually we're doing research on it, and it's for the most part working great. People are like, oh, it turns out like we split the cable bill and we buy like a big bag of beans and we all share it. And like, so costs go down, people support it. And Jamie's like, I'm the landlord now. I'm not going to kick them out. She charges people 30% of their income, and that covers her carrying costs for the house, maintenance, taxes, and the like. She bills Medicaid for the services that she's providing, and she's taking people right off the streets into these houses that would otherwise be empty. I think she's a great person, and BAX is just one of many really incredible programs in the area to watch. So why don't I've sort of talked your ear off. Why don't I stop and take questions?
Thank you. This is great information. So first question is, and can you hear me? I'm not seeing myself showing up on the video, so.
Yeah, okay. I can hear you. Yeah.
So are the newly homeless more likely to be the older population, the over 50 population?
Yeah.
And can you talk a little bit about
So one
the
of
sort of
my
cycle of homelessness?
Absolutely. So one of my sort of passions is homelessness among older folks. Like for the first part of my career, I gave like lots of talks like this where I was like, homelessness is something that happens to people between the ages of 25 and 44. And all the while that I'm doing that, I'm working in the hospital and I keep admitting people to the hospital. I'm like, oh, they're not 44, like they're 50. And they're like, and so I kept noticing it. So at one point we looked in our data and we realized we had a series of like cross-sectional studies. And we found that in San Francisco in the early 1990s, only 11% of people who were homeless were 50 and older. And by 2003, 37% were. And when I go into San Francisco's point in time count data, and you take out the youth and you take out families, because moms aren't 50, but you take those out and you just look at the single adults, then half are now 50 or older. And so then I became very interested in this group who were 50 and older. And I was like, well, are these people who were homeless since they were 20 and have stayed homeless, or is there something different? So my colleague at University of Pennsylvania, Dennis Culhane, did some work in the shelters across the country and realized that there's this big bubble of people who were homeless, that if you look at it, there are people born in the second half of the baby boom, about 1955 to 65, have been at elevated risk of homelessness their whole life. So when they were in their 20s, there was like a huge bubble of people who were homeless in their 20s, 30s, 40s, and now they're in their 50s, and there's this huge bubble. And we can talk about, like, gosh, there's lots of reasons why this age cohort really had things did not go well for them. But it's still left open the question, like, are these the people who've just been homeless forever, or is it something weird going on? And so I enrolled a cohort of 350 people who were in Oakland. They had to be homeless, they had to be in Oakland, and they had to be 50 years old or older when we enrolled them in 2013, 2014. And what we found was that 44% of them had never been homeless, not even for one night, before the age of 50. And there was a pretty big difference between the people who had been homeless in their like 20s and 30s and 40s and people who first became homeless in their 50s and 60s, particularly people who were homeless in their 20s and 30s. They were often people who had really, really devastating childhoods, lots of adverse childhood experiences or ACEs. Life never really went well for them. They got caught up in the criminal justice system. They were in and out of prison or psychiatric hospitals. And it was sort of like, these are the people who need permanent supportive housing, right? That's who it was. The people who were first homeless after 50 were very different. They were generally working people. They pretty much had all worked all their lives. They'd often worked more than one job. They generally were in pretty physically demanding jobs. So they did things like warehouse work, or they were like a warehouse worker during the day and a security guard at night. It was like a pretty common story. People were truck drivers, warehouse workers, stock workers, people working in construction and other things. And then what happened is sometime after 50, something happened. So these are folks who were just making it month to month to month, living paycheck to paycheck. And then something happened. And that something was, we were able to characterize it to like one of generally four things. Either they lost their job, their job moved out of state, 55-year-old person, maybe a GED, not any computer skills, could no longer do backbreaking work, no jobs for them, right? They got sick and they couldn't do their job anymore. So they were all doing well until they threw out their back or until they had a heart attack, and then they couldn't work anymore. And there was nothing for them. They were too young for retirement or Social Security. Their spouse or partner lost their job. So sometimes they were still working away, but the way they were making it work was they and their spouse were contributing, and their spouse or partner lost their job, or their spouse or partner got sick, or interestingly, their spouse or partner died, or their mom died. We saw again and again and again the stories of people who were living with mom. They were from Oakland. They had lived here their whole lives. They lived in the house that mom had been in since, the 40s or the 50s, the house that they had grown up in. Mom gets sick and dies in her 70s, and they, it turns out, have no tenancy rights for the house. The house isn't in their name. They have no rights to the house. They lose the house, and they wind up on the streets of Oakland. The other thing, which we haven't published yet, but we're just about to submit, that's actually really horrifying, is that the people who are first homeless after 50 were about twice as likely to die as the people first homeless before 50, because now we've followed them since 2013, 2014. Of the original 350 people, about 80 of them have died, even though the median age when we enrolled them was 57. Half of the people were between the ages of 50 to 57. The age of death is about 61. And I think this is, for a couple of reasons why this group died so much more than the group who was homeless before 50. For the people who've been homeless a long time and were still alive, there was probably something about them that made them healthier, that right, because they if they had died, they would have died before they were 50 perhaps. The other reason was, it's like the health shock, like people, it turns out it's worse for you. It's more of a risk for you if you have your blood pressure controlled and you suddenly stop taking your medicine than it is if you never had it controlled. You're more likely to have a heart attack or a stroke. But the third reason is a lot of the people became homeless actually because they were sick. They got cancer, they had a stroke, they had a heart attack that caused them to lose their job. They became homeless, and then they died from that disease. And so that to me has really changed my thinking, right? The other group, we definitely need permanent supportive housing. These are folks who've never really maintained their own home. They need the support. This other group, we need to find them before they become homeless and do whatever we can to prevent them from becoming homeless. And if we become homeless, we should just get them into whatever housing we can quickly. A lot of them who got housed went back to work, actually. We have a lot of folks who can only do the study at night or on weekends because they're working, once they got housing again. But many others just fell apart. Like one thing led to another, and now they're just doing terribly.
Can you talk a little bit about the other end of the spectrum? So instead of people who are older than 50, younger folks who somehow find themselves on the streets. And one example would be LGBTQ people who aren't welcome at home anymore.
Exactly. I mean, youth homelessness is a whole other story. And when I think of youth homelessness, I think of like two different patterns of youth who become homeless. The one that's a little more visible in San Francisco, it's like the kids in the Haight District. I live in Berkeley, and it's sort of like the kids who are in downtown Berkeley. Those are often kids, they have very high probability of either being a gender sexual minority, LGBTQT kid. Those kids, unlike most homeless folks who are actually most people who are homeless are actually homeless wherever it is that they became homeless. Sometimes they'll move from the suburbs into the city, but they're not tending to move across the country to be homeless. That's not so true for these kids. These kids are often fleeing a bad situation, and they're often like from someplace else. There are also other kids who've had like sexual trauma or other reasons why they just needed to like get out of Dodge and they leave home. The other big group of homeless youth that I think gets a lot less attention, but is a really important group, are Black youth, many of whom are exiting the child welfare system. So they got taken from their homes and put into the child welfare system. But when that ends, which in California is at age 21, they really are often exited with like no family support, no money, no job skills. They've often gone through a lot of trauma, which is tied up to why they had to leave their home. And they're at very, very high risk of homelessness, extraordinarily high risk of homelessness. Those kids don't associate with the other kids, right? They don't use the same services. They don't see themselves. They will do everything that they can to hide the fact that they're homeless. So they're not as visible to the population, but they're about equal numbers of those kids who have very high needs and, deserve and need our support. When I talk to my colleagues who work with those, they say we're trying to create healthy adults, and they might not need permanent supportive housing forever, because our goal is to get them back into the workforce and get them back to school and have them sort of achieve the usual things of adulthood that we want them to, but they definitely need a fair amount of support as they go through that rocky period. And they kind of need, in a sense, parenting, right? They need the things that those of us who have young adult children do, which is like, we're there for our kids, and, it's money, it's like advice, it's connections, it's all of the things that we would do for our young adults.
Are there any programs or organizations that specifically target the youth homeless population?
Yeah, there's some.
Can you mention any that we might be?
Yeah, wonderful one. So a really incredible one in San Francisco is called Larkin Street Youth Services. And they do really incredible work in both housing and outreach and job creation. Their executive director is just fabulous. And they're really, really incredible organization. They just opened and called the Lark Inn, which is the first navigation center for youth in San Francisco, which is like a souped up shelter with other services, but they operate a lot of housing and they're just a great organization. There's several good organizations that work with people leaving the child welfare system, TAY youth or transitional age youth that do great work in the Bay Area as well. But Larkin is just an incredible organization doing a lot of really groundbreaking work.
So housing obviously is the problem, or a major problem that affects homelessness.
Yeah.
And so there have been some new developments in modular housing construction that reduce costs.
Yeah.
What other approaches are you familiar with that have come at that side of the problem to help increase housing?
Yeah, I mean, I think one of the big problems in California is, it's an incredibly expensive place to build. Zoning rules are really, really tough here. Like, it's just really hard to build. And then it's expensive to build, in part, ironically, because housing is so expensive. Like when housing is really expensive, wages get driven up because you need your workers. Like construction isn't something that can be outsourced, right? So the construction workers can't drive 4 hours to work an 8-hour day, so construction costs are high. So modular housing, I think, is really great. The other thing I'm pretty bullish on is ADUs, like just allowing people to build another unit in their backyard. It's not going to solve the problem on its own, but we need every unit of housing we can get. I was personally really excited that Berkeley, which was sort of the epicenter of exclusionary zoning and sort of created exclusionary zoning in this country, just passed a law to ban single family housing zoning. So you can no longer say that areas can only have single family housing. You've seen some other, Minneapolis did it. Pretty much the entire state of Oregon did it. We need more of that in California because we do need more density, and we need more density more creatively. But I think modular housing is really exciting. If you can build a lot of the housing in areas that are lower cost and just get it here, is definitely exciting. And frankly, we need to just make it harder to block the creation of housing. And I think there is a little bit of a alliance that sort of breaks my heart between like the far left and the sort of anti-housing exclusionary folks have sort of joined together to manage to block any movement towards increasing housing. I mean, if you don't care about housing and you just care about the environment, like it's awful for the environment that we have people commuting 2 or 3 hours. Like there's lots of reasons why we need more density, and we need more density in areas near transit, particularly, so that people can get to work. But we also need to be careful that when we create new housing, some of it is going to need these deep subsidies, because what I hear from my friends in sort of the housing creation world is that they cannot create housing for ELI households and make it work without a pretty deep subsidy. Like the numbers just don't pencil out, and they can't, they're not in that, like they can't go under, and so we actually need to work not only on things like vouchers, but in supports for housing creation, for housing that is created for low wage workers. And, sometimes people will say to me like, well, maybe the Bay Area isn't an area for poor people. But here's the thing, like, hospitals need people who clean hospitals. Restaurants need people who wash dishes. Like these jobs are essential for a reason. Like we saw in the pandemic, right? All of these jobs that we didn't let people stay at home for, because like we would fall apart if our grocery stores all closed. We would fall apart if we didn't have, our cleaning staff in our hospitals and in the places that we go. And I get it when I talk to hospital CEOs who say we cannot pay $60 an hour for a starting janitor. Like that doesn't work. And I said, like, fair enough. I hear you. But you also then need to do what you can to advocate for the creation of affordable housing, because you can't have people commuting 4 or 5 hours to work as a janitor in your hospital. Like that just doesn't work. And so I think we do need to bring incomes up, but frankly, we're not going to get incomes up high enough unless we bring the cost of housing down. And the only way to do that is to create housing that's subsidized so that we can afford to rent it to low wage people.
Is there communication at that level between the homeless support advocates and the housing advocates, so
Just-
that there actually is some collaboration there.
There is just starting, like, you know, for years, they were like the homeless people and the housing people. And like, we've started to see some merger finally, not enough, but some. Like, I just joined the board of a statewide organization called Housing California, which has always been a affordable housing organization, but they really got interested in and are actually doing really good work on homelessness. And they actually brought me in because they want to increase that portfolio. And it just made me happy, so that we're not separating out, like, because there really were, like, there are people who are like professional, like, we work in affordable housing, and other people are like, we work in homelessness, and never the two did meet. So you're starting to see more, you know, collaboration between them. But I feel like we need a movement of people saying, and this is unacceptable, even for those of us who are really lucky and have beautiful homes. Like, this is untenable, and we can't go on like this, because our elected officials need to move. Like, this is a problem where philanthropy can play a really big role in like doing the edgier things and providing the supports to get things supported. But the scale of this program is a scale that's way too big for philanthropy. Like, we need actually to get the federal government involved, and the federal government, it's a rounding error. Like, the federal government could solve this problem tomorrow if there was enough of an outcry to do so. But we actually need every level of government, right? We need the local government to create the zoning rules that allow for housing to be built. You need the state government paying for certain supports and allowing those supports to be used appropriately and to helping the home building. And then you need the federal government to provide the big subsidies, I think, because I think they're probably the only ones who can truly do it at scale.
So what do you think along those lines? Do you have an idea of the pushback in all levels of the government?
Yes. Yeah, I mean, you know, elected officials who I hang out with a lot, and like many of them, but they really tend to respond to what they're hearing. And people calling to, you know, for mayors, what they tell me is like, you know, up and down the West Coast, I've talked to just about all the big city mayors, and they basically say, this is where I'm going to lose my next election. I'm going to lose my next election because they're homeless people. And what people want is homeless people out of their eyesight, and they want to put them in shelters. And then I try to build shelters, and no one wants shelters in their area. And they're like, I don't know what to do. And it's not like, you know, I always say, like, because this is my job, I wind up going, I guess pre-COVID, now I do it online, going to meetings where people are trying to cite like low-income housing in communities. And what happens is, like, everyone on this call who's like, yeah, I wouldn't mind that. Like, that sounds like a good idea. On Tuesday night, like, you've got something better to do. Like, you don't think like, oh, I need to go and hold up a sign saying, yes, I'm not going to block you building the housing. Because like, why would you think that? But it turns out that when I show up to these meetings, there are, you know, I always call them like the people in the matching t-shirts. They're like always people in like, you know, matching t-shirts with signs saying like, not in my neighborhood. And people always invoke their children. Actually, one of the most powerful moments I've had was I was in the city of Alameda, and there was a conversation about supportive housing for elders being built there on great piece of property, totally abandoned. It was like fantastic, right? Everything was great about it. The neighbors got together and were trying to block it because they didn't want, you know, homeless people, mostly people of color, right, in their neighborhood. And they were really frightened, and they all were in matching t-shirts. They had signs, and there was no one to speak up for it other than, you know, I was like trying to pass a microphone. And at one point there was this one woman not in the t-shirt, and people were yelling like, I'm afraid for my kids. I have kids. I can't do this. And this one woman raised her hand. She hadn't said anything the whole time. And she said, you know, my name is whatever, and I'm a middle school teacher at the middle school, you know, right here. And I spend all day with your kids. And let me tell you, your kids are seeing this suffering, and they're looking to the adults to try to figure out, why are none of the adults doing anything? And so she said, like, don't tell me you're worried about your kids. I'm worried about your kids. I'm worried about like their moral development and their sense of like a possible future. And it was like mic drop. And I will tell you that there was a big election to like block this that I thought was going to go the wrong way. And she spoke, and like it turned the tide, and now they're building like about, you know, 60 units of beautiful housing with supportive services for frail elders to move into. And it's really exciting. So one of the things is like, be that person who shows up, because like a lot of people are like, yeah, I wouldn't mind having an apartment building where there were some low income people in the apartment building near, but like, you don't think to show up and say, yes, please build it, because that feels weird, but it's actually necessary because the people who don't want it are super organized. So that's at the local level. I would say at the state level, it has been just paralysis in state government about this, because as I said, like there's this movement like, you know, Scott Wiener, who's like trying to put like SB 50 and things to try to build more housing in transit areas. He's sort of managed seemingly to piss off every side, right? Like a lot of people don't want more density in their neighborhoods. At the same time as people are saying it's not doing enough for ELI renters, or it's going to gentrify neighborhoods. And so it's just really stuck. And I really think we need to find a way through that, right? We need to find, we're just in paralysis. So year after year, there's this aggressive housing agenda and nothing happens. And then the feds cannot, like this, you know, I'm a housing nerd. So like I watch every, like, you know, my mom was in League of Women Voters when I was a kid. So I've like been like watching elections, right? Since I was a kid, I was like, she would always take me to the, like serve as a poll watcher when I was 7 and things with the League. It was awesome. But she, you know, when you watch presidential debates, or even Senate debates, like there was the words housing or homelessness never came up until this election. And so there were a lot of elected officials who I liked a lot better than Trump, I'll just say that, but who didn't really take this on as their issue. It just wasn't on people's minds. I think if you're in a lot of this country, it's pretty invisible. And I think if you're in the areas with really high homelessness, people feel really hopeless about it. And we just can't get any traction. So this election cycle, people started to talk about it. And it like, there was like a whole text thread with like a lot of my friends in the movement who like someone mentioned the word housing in a debate. And like, you would have thought like we had won the lottery. We were like, and like literally all they said was like, we need affordable housing. And we're like, oh my God, this is the best thing ever. So it just hasn't really been on the agenda. And so I think that is another thing for advocacy groups to do, is to put it on the agenda and to like really talk about it, particularly at the federal level. Like the mayors and city council members and state folks hear about it all the time, but the feds are never called to account. And I feel like there's an inverse of like the blame, like mayors get blamed the most, but actually have the least control over this. And our congressional delegation and our president, who actually could solve this, we never blame them for the problem. And so they never talk about it.
We are definitely having conversations about it here in Piedmont, but I do understand there's only so much we can do locally. We're almost out of time. One final question. Is the majority of the homeless population people who were born and raised here, or is there lots of movement into the area? Is it climate-based at all, like warm,
really
moderate climate?
Interestingly, you would think it would be, but it's not. The youth are not generally from here. The sort of LGBTQ youth, those are often kids who are escaping, and the Bay Area is one of the places that is, you know, and I'm proud, right, that the Bay Area is a source of sanctuary for kids who are kicked out of their families because they're gender sexual minorities. But the adults remarkably are from here. They're actually more likely to be from here than the housed community from here. And so the vast majority are from the area. About across the country, no matter where you are, 70 to 80% of homeless single adults are living where they spent their adulthood. And it's actually really funny because like I, again, pre-COVID used to travel around the country giving talks like this, and wherever I went, everyone is convinced that their area is like a homeless magnet. So it was sort of a joke in my household. I like get home from a trip and my husband would be like, you know, how was Columbus, Ohio? And I'd be like, oh, you're never going to guess. And he's like, let me guess, Columbus, Ohio is the homeless magnet of the country. I was like, how did you know? Like, you know, it's actually, it's kind of, it's easy to believe that. There is some movement Like people need to, often they'll get into a fight and they'll need to like get out, there's some reason why they need to leave an area, but it's pretty random. There isn't like, as many people leave and become homeless in other places as come. And so it's about 70 to 80% of people who are homeless in this region grew up in this region. And for the 20%, they're sort of balanced by people who grew up here who have now gone to other, who have now gone to Las Vegas. And then we've got some people from Las Vegas. It's pretty random. It's not a huge draw for adults.
Thank you so much. Before you leave, can you give another shout out? You've mentioned a few of organizations. Can you mention like so that people can take notes here at the very end?
Yeah. So I talked about Bring California Home and All Home California are doing sort of bigger, like wide scale advocacy things. Some more local orgs that are doing incredible work. Bay Area Community Services is one of my favorites in the East Bay. Another organization, fantastic organization that has a big footprint in the East Bay is Abode Services. They do shelters, permanent supportive housing, sort of like back, so they do a slightly different work, but they're incredible as well. For youth, Larkin Street is really incredible. And for families, Hamilton Families, which is based in San Francisco, but works in the whole region. Those are really highly effective nonprofits doing really great work.
Thank you. Thank you very much. Thank you all for joining us today. Thank you to our speaker, Margot Kuchel, for taking time to be with us.
Of course. Thank you for joining. Thanks. Bye-bye.
Take care.